Hi, my name is David Bartlett. I'm a patient with a neuroendocrine tumor. I was diagnosed 6 years ago. And I'm also, or have been, a GP, having worked in the same practice for 35 years. I'm now mostly retired. Um, and I thought it might be helpful to talk about the diagnosis of NENS from the point of view both of having been a doctor and having been and still are, of course, a patient. I want to start with telling you about a story about a bird, the kingfisher. Some years ago, I was walking with a friend not far from where I live here. Friend who's very keen on bird watching, and we were walking by the river, and I said, "Look, Dave, I've never seen a kingfisher." And as I said it, he said, "What do you mean, that bird flying past now?" And it was one of those sort of miracles. I thought he was the sort of Paul Daniels of the bird world. But lo and behold, there it was flying past. In fact, he said to me, "You've probably actually seen quite a few, but you just haven't really noticed them." And that's a problem that we all face in all sorts of aspects of life. As a GP, it's very easy to miss things. And I remember the time when I was examining a young baby. It was a great joy to examine newborn babies and 6-week-old babies, to congratulate the mum and dad on this wonderful baby that had been born, and always remembering to say how beautiful the baby was and how perfect it was. And so I examined this little baby girl and said to the mum my standard lines, she's perfect, she's beautiful in every way. And the mum just sort of hesitated and looked at me and said, did you look closely at her hands?" Yes. "Did you notice she had 6 fingers?" "No, I didn't notice she had 6 fingers." The problem was that I looked, but I didn't see. And one of the challenges, if you're a doctor, is to be seeing patients who, as it turns out, will have neuroendocrine tumor, but you haven't even noticed or been aware of the possibility that neuroendocrine tumor might have been their diagnosis. So you only really see what you're closely looking for, is what I sort of want to be talking about for a few minutes. But I want to share with you some of the challenges of being in primary care. It's a great career. I've loved my career, but it does bring its challenges, and not least the weight of the work and the responsibility of the work, but also the challenges of actually doing the work well. And I just want to mention 2 or 3 of the challenges. There are multiple more, of course. One of the big challenges is what you're taught at medical school, which is that common things occur commonly. So we're taught to not think in terms of the rarities when we first see a patient. I recall an early ward round when I was at Westminster Hospital in London training with an eminent old physician called Dr. Garvey. And we were gathered around the bed of a patient who presented with a cough. And he turned to me, "Bartlett, what do you think this might be?" And I of course, shook in my nervous shoes and mumbled out something like it could be TB, or it could be mesothelioma, or it could be asbestosis. And he said, how about saying it could be that he's a heavy smoker?" And they wanted to drill into, look, think in terms of the common things first. Think in terms of common things. Don't go straight to the rarities. Now, that often stands you in very good stead as a GP, but it can lead to other problems, particularly in the delayed diagnosis of neuroendocrine tumor, which was my experience. So one of the first challenges in general practice with regards to neuroendocrine tumor is that common things do occur commonly, and it's drilled into you, and you have this buzzing in your head the whole time. But secondly, the other thing to say that's a challenge is that rare things also occur commonly. And I appreciate, even as I say that, that sounds contradictory. But just stop and think for a moment. It's said by the National Institute of Health in the States that there are 7,000 rare diseases, 7,000, which approximates to somewhere between 8 and 10% of the population who will have a rare disease. Now, the majority of these, something like 2/3 of them, are diagnosed in childhood and tend to be genetic and will often come to light very early on. But that leaves a significant chunk of conditions that are rare in and of themselves, but collectively occur relatively commonly. So every primary care practitioner will be seeing rare conditions coming their way. It's interesting how perception has such an effect on life. And the perception would be that there are some cancers that are much more common. So, for example, most people have heard of pancreatic cancer. But in actual fact, the prevalence of pancreatic cancer in a population is less than the prevalence of neuroendocrine tumor. Yeah, the incidence of it is greater. In other words, there are more people diagnosed each year with pancreatic cancer. But because, sadly, the prognosis, generally speaking, is less good, it means that there are more patients living with neuroendocrine tumor who may yet not be diagnosed with that neuroendocrine tumor. So in other words, yeah, rare things are rare in and of themselves, but can occur commonly. So there will be patients with neuroendocrine tumor that's on the books of most GPs that may yet have not been diagnosed. But the third challenge in general practice, which is a big one, is that, yeah, common things do occur commonly. And I'm back to my first point. And it does mean that much of the attention and much of the noise, if you like, in general practice are the common conditions, the diabetes, the asthma, the raised blood pressure, and so on and so forth. And it's almost as if they're the sort of continuous noise, the continuous background noise that you experience in general practice. One of the consequences of that background noise is that you don't then hear the occasional different noise. You may remember those halcyon days in the early days of COVID, when public transport was much reduced, when there were virtually no cars on the road, and all of a sudden you could hear the beauty of birdsong, the blackbird twittering away in the background. It was beautiful. But that was because there was a removal of attention that's given to the background noise. One of the challenges of general practice is how can you remove that background noise so that you notice the different, the relatively unusual, the blackbird that's singing. So they're just some of the challenges of general practice that it's inculcated in us that common things occur commonly. But equally, we need to relearn the fact that rare conditions occur commonly too. But also, because common things occur commonly, we sometimes need to just move things away so that we can hear the rarer. Right, so there's some of the challenges. What are the opportunities, though, that we have, both as patients and as primary care practitioners, to make the journey to the diagnosis less long, to hopefully shorten that interval? And I just want to suggest 4 or 5 things that might be helpful. And the first thing to say is, how can we remove that attention to the noise that's going on around us and notice the rarities? I've suffered with a condition called tinnitus for about 20 years, and one of the approaches to tinnitus is to wear a hearing aid like that. And the reason for wearing that hearing aid is not that it lessens the tinnitus, but it makes me more aware of what's going on around me. And by being aware of other things, I'm less conscious of if you like, the background tinnitus that's always there. And one of the things I want to say to my colleagues, and indeed say to us as patients, is just be aware of the fact that this patient that's coming back to see me, and that's been more than once and that's seen other doctors, may well have a condition that's rare. For those of us who are patients, I know it can be very difficult in our relationship with our GP when we're feeling frustrated that we haven't yet been diagnosed, we don't know what's wrong with us, and that we don't seem to be getting anywhere. And it's very tempting to get very agitated about it. Whereas if we can find a way of establishing a relationship with our GP such that we say, look, I'm really struggling with these symptoms that I've had for such a long time. I really need your help to somehow get to the bottom of this problem that I'm facing. And possibly even dropping into the GP, do you think I could possibly have something rare? Maybe rather than going with a list of sort of 20 rare conditions that will probably just be greeted by a GP putting his or her head in her hands and saying, I can't possibly know all about 20 rare conditions. But nonetheless, for both us as primary care doctors and for us as patients to just realize that rare conditions do occur can be helpful. Secondly, how can the primary care practitioner be more alert to the diagnosis? We hear a lot about so-called mindfulness these days, and really mindfulness isn't particularly new in a way. It's just encouraging all of us to stop, look and listen, which is, I think, what used to be called the Green Cross Code. And I'm certainly very aware of it now that we've got 2 young grandchildren, and I'm trying to encourage them to be disciplined when they come to the roadside. Dear little Rosie, my 5-year-old, I fear for her if she goes anywhere near a road. I wanted to stop, I wanted to look, I wanted to listen. And I think those of us in primary care can often just feel on a treadmill of lots of patients, lots of blood results, staff to look after, and so on and so forth, that we just don't do that stopping and looking and listening at the patient in front of us. I saw a cartoon recently of somebody that was trying to be all meditative, and there was a speech bubble above their head, and they said, I want to be in the moment, but not in this moment. And I think that's one of the difficulties, that we all know that we just need to experience the moment where we are now. But so often we're thinking about the moment where we're going to be. When I was first diagnosed, or rather soon after I was diagnosed, I had surgery for my small bowel neck tumor. And after the operation, I did find it quite uncomfortable, if I'm honest. I know I'm a man, so you've got to allow for that. But I did find it quite challenging. And a nurse would come into my room every a certain number of hours, or once or twice a day, and get her clipboard out and ask me what sort of level the pain was, anything between 1 and 10. And just on a couple of occasions when I wasn't feeling great, I said, 12 or 13. And I saw her just write down and then left the room. And I thought, I've just said it was 12 or 13. And she just wrote it down. And somehow, as professionals, we need to just have the capacity with this patient in front of us to stop and to look and to listen and to think. And I know it's difficult as patients to encourage our doctors to stop and look and listen, because and I know that often our medical colleagues are looking at the computer rather than looking at us. But somehow to find a gentle way of saying to our doctor or whoever we're seeing, I hesitate to say that I encourage you to say to the doctor, can you hear what I'm saying? But to just somehow encourage them to say, look, these symptoms are really getting the better of me. They're beginning to dominate my life. I want to be better. I'm not getting anything out of being ill. I really don't want to be ill. I want to be better. Can we just have a rethink about what's wrong with me? And on that point, thirdly, what other opportunities do we have in primary care? And I think one of the things I would say in the light of my diagnosis is that we need to doubt our certainties. And the reason I say that is that before I was diagnosed, I was seen by a couple of colorectal surgeons, a couple of gastroenterologists, very eminent gastroenterologists in a regional centre. He kindly saw me on a Saturday morning, because I was a medical colleague, possibly, I don't know. And he sat and listened to my story and the investigations I'd had. And he said, yep, you've clearly got irritable bowel syndrome. And obviously for a short while after, certainly until I was diagnosed, I was reassured. But he was so confident in his diagnosis that in retrospect, he shouldn't have been. And I think in a way he illustrates one of the problems of the experienced doctor, because the experienced doctor begins to know more, and by knowing more, you perhaps doubt less, which in some ways, of course, you need to do, but doubt less your thinking and your diagnostic ability and so on. But he didn't seem to have any capacity to doubt his certainty, even though my symptoms had gone on for some years and, yes, had been investigated to a degree, but he didn't even raise the possibility of the rarity. And I think, again, it would have been great if he could have just shared with me the fact that, yeah, I'm 95% certain, but there's 5% of me that just wonders if something else is going on. And I think I think that kind of approach from a doctor's point of view is quite helpful, to admit that you're 90% or 95% certain rather than 100%. And maybe as a patient to be able to say to your medical colleague or or rather your attending doctor or nurse or whoever, are you absolutely sure that we're not missing anything? Now then, just rounding things off, I think a fourth opportunity that people who have or professionals have who work in general practice is to just somehow maintain a spirit of curiosity. Because as I said earlier, we can so easily get on the treadmill of working. We're just doing the same stuff over and over again. And it's as if we get into autopilot and we're just doing the same things over and over. We don't even need to think about it. Some years ago, my wife and I were flying over from the mainland to the small Hebridean island in a very small 9-seater plane. And at one point, as we were flying over the sea, my wife said that the pilot's not holding the steering wheel. He's just filling in his logbook. And I was able to say, not that I understand much about these things, don't worry, darling. He's put it on autopilot and everything will be fine. Now, autopilot is fine when you're in a plane and when it's a pilot, but autopilot's not good when you're a professional. You need to just have that ability to stop and just be curious about the things that are going on around you, about the patient that's seen you and that's seen another colleague who's not getting any better. You just somehow need to maintain that spirit of curiosity. And it's not easily gained because it's easily squeezed out by the pressures of the job. But if as professionals we've lost our curiosity, we probably need somehow to rekindle it by being around enthusiastic people and passionate people, and just remind ourselves how lucky we are to be in a job that has such variety. When I think that my dear old dad, when I was a young boy, just worked in a factory doing the same thing every day, how difficult must that have been? And yet in general practice, we have this variety of things coming our way. Curiosity is a wonderful thing. I've mentioned a couple of birds already, the blackbird singing and the kingfisher. The robin's another good bird to think about, because if you do any kind of gardening at all, it isn't long before you've got the robin near you, curiously looking up at you, looking around at the soil you've turned to see if they can find a worm or whatever. Curiosity is really important. Now, I know I've sort of talked about all sorts of different things, particularly from the point of view of the primary care practitioner, but also from the point of view of the patient. And just to round off by saying, it is difficult being a primary care doctor because common things are coming your way all the time. And for those who work in general practice, I want to encourage you somehow to just listen out for the blackbird and to be curious like the robin. And from a patient's point of view, I think to have some kind of understanding of the challenges of being a doctor. I understand the challenges of being both a patient and a doctor, but I think for you to understand the challenges of being a doctor just might help you in your relationship with your doctor, and might help you find a way of communicating with your doctor that rather becoming angry with them or frustrated with them, you're able to say, look, I do need your help and I so respect your judgment. And I'd be so grateful if we could just have another rethink. That would be really great. Maybe that approach would be helpful. Maybe that approach would lead to a shorter time between the onset of symptoms and the diagnosis. Doctors can feel overwhelmed by rare conditions, but one of the great things about Neuroendocrine Cancer UK is the phenomenal amount of great information that they have on their website. So the GP needn't feel overwhelmed. He needn't be an expert in the condition. He can look at the resources. He can point you and I, patients, to these resources. They needn't become an expert. They just need to know enough to join you on the journey. And hopefully your journey will be all the better for that. So hope you find that helpful. Thanks.